Hi there, welcome to Linked Over Lunch. I'm Nancy Mader, the Director of Transition Projects here at the Federation for Children with Special Needs.
And I'm Pat Nemia. I'm the Project Director for Mass Family Voices, a project here at the Federation also.
And we are going to talk about healthcare transition today. And we're going to try to keep it short and provide you with as much information as we possibly can. And we're going to start with, what is healthcare independence?
So one of the things that's really important to healthcare transition is creating healthcare independence with our kids. And so we talk about what is independence. And easy definition of independence is being able to do something all by yourself, right? Anything you look at. But I think one of the things that we think about when we think about healthcare independence, I like to give the example. I'm a healthcare provider, and for example, when I work with clients and we're trying to help them learn to ambulate independently, we don't just say, okay, here's the walker, here's how you use it, and you're off. We work with people, we teach them like how to walk outside,
Right.
how to navigate curbs, how to navigate bumps, all the things that can come up. And that's really what, when we talk about creating healthcare independence with an individual, is it's thinking about how do I manage my healthcare by myself, but in the environment where anything can happen. What are all the bumps and the changes and the forks in the road, and how do I handle them?
Right.
So, so I think it's one of the things that we want to talk about is also that how is that healthcare independence then part of the transition process, or what does it mean to use that to have a successful transition?
Right. So what does it mean? So how do you integrate it into transition in high school or at home?
So I think that when we look, when we talk about transition, everybody right away thinks about educational transition or transition to a post-secondary situation, whether
Right.
it's school, work, community-based program. But we don't very often include healthcare in that conversation. And really, developing healthcare independence, being able to understand and coordinate your own healthcare is really, really foundational to any of the other transition processes being successful, because when your health is at its optimum, and optimum will mean different things for children and youth with special health needs.
Right.
But when it's at that optimum capacity, it's going to give you the best foundation for being able to work or go to school or be in a community program or setting. And so it's really important to think about it. And also to remember that healthcare independence is the process by which healthcare transition will take place.
Right.
That it can't just be a moment in time. That, oops, I'm 18, where's that new doctor?
Right.
Because then it won't work. It's got to be something that's kind of taking place over a longer period of time, that we're building skill and developing over time.
Right. So how would you start? What is your advice on how you would start to build healthcare independence?
Well, like I've said, I think it's a lifelong process. And one of the things that Nancy will be posting for you after is some of the resources that I think are very valuable for parents regarding this. And one of the resources that's great is the Department of Public Health has guidelines for transition for children, looking at healthcare transition and starting the process when they're about 4 years old.
Okay.
And starting it at home and then incorporating it at school. So it's a really nice document to look through. It gives you suggestions and ideas. And it talks about, at different ages, what is a child able to do as far as understanding their own health care?
Okay.
What is my diagnosis? What does that mean? How do I recognize the symptoms associated with my diagnosis? How do I advocate for help when I'm feeling different symptoms, for care? Right. And those are skills that children can develop. How do I advocate in the doctor's office for myself? Talk to doctors, make doctors and the medical community part of my life, which kids with special health needs are going to be able to need to do, because this is going to be a lifelong process for them. Regardless, whether, you have the spectrum of medical intervention with kids with different diagnoses. Some may require less than others, but it is still going to be a process they're going to be involved with their whole life. And so how do I manage the doctors and the providers? And so that if we'll give you that resource, but that's something that you build with a child as they grow.
Right. Well, I don't think I made my first doctor's appointment by myself until I was like 25.
Right.
Right.
Right. And nobody does. And many times kids don't get, when they don't have to hand in that annual physical anymore for school,
They stop.
they don't go for their annuals.
Right.
And, for children that are, or now young adults that are typically healthy, that can be okay for
Right.
a few years or so. But I mean, in general, what we're learning about healthcare and what kids need to appreciate is, preventative medicine is a really big thing, and screenings are really important. And going to an annual physical for anybody is really important. But really, most important for the population that we're talking about. And so you need to build the skills and the importance of that, I think, in all kids' lives, but especially in the population that we're talking about. And so people say, what are these skills? Where do I develop them? And I think that, there's three places pretty much, which is probably kind of your whole environment. There's school, there's home, and there's the doctor's office, where in particular you need to be developing skills as a child, a youth, and then a young adult. And then when you get to young adulthood, being able to understand your disability, understand your healthcare becomes important in like the workforce.
Right.
And so one of the first skills that we would talk about, with kids is disclosure, and you do a lot with this now.
Right. Understanding what you need, what your accommodations are, what you need for your employer to know, your college to know, your friends to know, is really important, because they don't need to know everything, but it might help them to understand you better if you're able to disclose the best that you can what your diagnosis and what you need. I just think that starting those skills well before someone's 18, is you can't expect someone to go to college or go to work. And you talked about it the night before, and they're going to go in and disclose information that is really personal. But if you start building those skills when they're 12, even earlier, if that's possible, if they're 12, and when they're 13 and they're 14, and you keep talking about it, and it becomes part of who they are, and it's, that will take so much stress off of them when they go to school, when they go to a new doctor, when they go to work, or when they meet a new person, and that person can tell that they might be different, or it might be something that they want to disclose to people. And if they have that skill inside of them that they've been working on for years, it takes a lot of stress and pressure off of them.
Exactly. And I think that people say, well, how do we develop that? Certainly we understand practicing it at home. And it's funny because you hear in the, with the young adults going out for jobs, the elevator speech, what are you going, what's your elevator speech, right? When you have to tell someone in a minute what you want them to know about you. And that's exactly what we need these kids to do. They need an elevator speech that has essential information that, makes their work life easier. And that's something that, we practice interviewing in school with kids. That can be a skill we develop on an IEP. We do a lot of those types of things with them, and developing your kind of elevator healthcare speech is something else that can be worked on in school, be part of the IEP, be part of, as you're developing self-advocacy skills, can be one of the benchmarks or one of the goals of that, which is really important. I think, understanding, the idea of self-determination, and you tell me if I'm not exactly right about this, but the idea of understanding, what is my situation, what is working well for me, what is not working well for me regarding my health care, what is easy for me and what is not easy, because that's will be maybe part of your elevator speech, but things that as you understand about yourself, will help you be more successful as you go to school. As
picking a doctor, if that's something that they're able to do, knowing what you don't want in a doctor and do want in a doctor. I'm still learning that, and I mean, I've been around a lot longer, but it's hard to know those things. But you have to start teaching. I think all kids need this. Really, it's not just kids with special healthcare needs. It's all kids need to start thinking about adult healthcare, because it just happens all of a sudden. You stop going to your pediatrician when you go to college. you have healthcare, you might need a mental health care provider. And so having these conversations much younger and with all of your kids is really important, and it's really useful.
Right.
And then they can pick a doctor that they like. And, you know, for mental health clinicians, that's a really hard person to find. You know, finding someone who you want to sit down and talk to about, you know, your feelings, what you're going through. You know, most people don't find that the first shot.
Right. And you can be in a situation where you say, well, we're just going to use the person we've always used, but your child's going to college out of state, and that's not possible for licensing reasons or billing reasons. And so you have to change, or, you know, your child can go to college and there can be a new event.
Right.
And they may have to go see who's available. So being able to let that person know what works well for them, you know, in this type of setting, what interactions have been most beneficial to them when they're in crisis or when they are facing a new stressful event is really important. You know, and you know, to the other skills I think that are usually in the IEP when we talk about especially the transitional age are, so self-advocacy, we said, self-determination, disclosure, but also you do things around organization, around transportation. And when you're doing those should be things where you're also thinking healthcare. So we're organizing kids, how to keep a calendar. We'll include in that your doctor's appointments, or how to keep your daily schedule. Include in that what do you need to do as far as medicine.
Right.
You know, if you're a child with, you know, maybe you're in school and you have a diagnosis of ADHD and you're taking medication at school, or diagnosed and you're taking medication at school. From an early age, you can be involved in saying, oh, wait a minute, it's 10 o'clock.
Right.
And trying to take as much independence in that process as you can. And so then, you know, managing your medication becomes something you've done your whole life.
Right.
It's not something new at 18. It's something you've done your whole life. You're used to it. And then you can talk about when you're planning a schedule at college, how do you incorporate that into it?
And how does your medication get to you?
Right.
You know, so you can set it up with you can be with your student and set it up with your pharmacy for it to be renewed every 3 months or whatever, however often you can get it. And that text message can come to your student, your child's phone. So they can say, oh, mom, we need to go pick up mom, dad, guardian, whoever they're living with. We need to go pick up my medication. So they're starting to own that then, instead of, you know, when they live independently, or when they go to college, or when they go to work, or, you know, whatever their situation is going to have, that they get that text message and they can own that piece. And it gives them a sense of freedom too, and a sense of responsibility for their healthcare. And I think that that's just really amazing if we can, you know, teach our young people these skills.
And so I think, you know, the other skill is transportation skills. We work on transportation so much, you know, in the educational transition piece. And we're looking at how are we going to get to the community program that we're in, how we get to school, how do we get to work, how do we get to the doctor? That needs to be another conversation. It's just another benchmark or goal that, you know, when they're learning these transportation skills, that's one of the things that you're talking about and considering. And it just becomes part of their conversation all the time. So we talk a little bit about, you know, just to give you some examples, we talked a little bit about the medication and that with certain diagnoses, but, you know, you can talk about, you know, kids with more complicated medical situations. So, for example, a child with diabetes who's kind of going out into the world on their own, a child with cystic fibrosis, kids who need more than just to track their medication, they need to coordinate their care.
Right.
They may need to coordinate things like durable medical equipment that's associated with that care. So if they're doing that in school and at a younger age, and they're understanding the importance of it to them, those are things that you can look at with them, you know. And then we talk about, you know, families. There's a you know, I'm sure people who are listening who say, well, you know, I'm probably going to be my child's guardian, and so really this doesn't pertain to me.
Right.
And you know, it's a range of ability, and there are kids, who will go to college and they have the ability to learn We can teach them their schedules, their medication, and their doctors and all of that. And there are children whose parents will be making the decisions for them.
Right.
But there are always things that you can be working on. Kids who use communication boards, are there ways to use those so that they can indicate to you something they need, something they feel, so that you can be more aware of their symptoms?
And they can be more aware
They
of
can
them.
be more aware of them and can benefit from being able to communicate that to you. And so anything like that where you can look and see, okay, what are the possibilities here for this child to communicate their health needs to me, their guardian? So I'm just not saying, oh, I think this is what we do. We do, this for medicine, or we do this, so that you can really understand whenever possible what their needs are. And it's also very important, if you feel your child is getting older, that you are going to be their guardian, then understanding what the difficulties for you are going to be with this diagnosis in the future. My child has a diagnosis of autism, and it's significant to the point where I say, okay, I'm going to need to be my child's guardian. What are the things that they need, and what are the available things out there? To all of a sudden have your child home with you and saying, what are we going to do now? But also understanding earlier on, having those conversations with doctors. As my child moves into adulthood, what happens with medications, with dosage, with payment of things? How am I going to financially afford this? There are people in the in community-based organizations, social workers in school who may be able to direct you, but also people in the doctor's office who are aware of how these things transition, that you need to become involved with.
And social workers at hospitals and in those organizations are extremely helpful in those situations.
And even if your question is, I'm going to be my child's guardian, what do I have to know? That's a place to start. That's a place to start.
Yep.
And you should start that when they're young.
Yeah. And start talking about it to prepare them. If transitions are difficult situations for them, start talking about it in different ways to them so that they're more prepared for it. Pat, what would you say the consequences of not supporting independence could be?
So I think that certainly what we've says that, if you support healthcare independence, healthcare transition, it's going to make everything better. And if you don't, I think the consequences for kids can be, again, a range, but they can be significant. And if you look at the population of kids who are moving out on their own, they're 18, and now they're the adult, and they're in charge. And everything in the adult world changes like this for them. Pediatric settings, pediatric providers across the board are much more nurturing, a much more inviting, a slower paced kind of healthcare. When you move into adult healthcare, that's very different. So kids have to be ready for that. But the other thing I think too is that many, many times, if this hasn't been talked about and kids feel like this has been controlled for them their whole lives, I think any young adult moving to college feels like, woohoo, the control is gone, and I am going to live life now and make my decisions. And so in a child who's not dealing with health issues, that's, can be fraught with issues. But for a child who is, what we see is many step away from their health care. Do I really need to go to a counselor anymore? I don't really need to go to the doctor anymore. If I don't get my meds this week, what's the big deal? And for a lot of kids, we see that as being the point where everything starts to unravel in school and at work. And so they wind up
their friendships, their family. It can affect all of those things.
And so now they're failing a class or two classes, and now they're on probation, or now they have to leave the school and try to get back in, or there's lots of things. And so, and it's a very hard thing for a child who's already dealing with certain health issues, to feel, or disability related issues, to feel again almost a failure. And I think if we work on healthcare independence, and if it is a part of their life, they recognize, hopefully, at 18, 19, 20, the need need for this because they've seen the success of taking care of it
Right.
themselves all along. And I think just, for kids who are in situations where they don't have the family support or community support, or maybe go to college and don't have resources available to them, these are kids that we see sometimes get into trouble.
Right.
And they don't have the support around them to help them. So as a result of stopping their medications, something happens, they make a bad decision, and now all of a sudden there's trouble. So I think what I am going to do, it was great having this. I think what we've hoped is to make you more curious
Yes.
about this, more aware and more curious. And so I have resources like the one from the Department of Public
Right.
Health. I have resources from an organization called Got Transition, which is a national center
Which is a great
funded,
resource.
yes, which can give you tools about looking at how many skills does your child actually have? Where is their skill set with regard to healthcare independence? What do we still need to work on? So that's a great resource. And
Yeah.
there's some others that I will give to Nancy
Yes.
for you to use.
Yes. And if you have questions, please send us a direct message. We'll get back to you, and we will post these things. And thank you so much for joining us for
Thank
Linked
you.
Over Lunch, and we'll be back next month.
All right. Bye.
Bye.